Hello, my name is Bailey Laub. I'm from Elizabethtown, Kentucky, and I'm currently enrolled in EKU's Family Nurse Practitioner program. I'm currently taking NSC 842 with Dr. Nancy Owens, and today we will be discussing advanced nursing practice issues that a rural nurse practitioner will face in practice. Healthcare is a multifocal resource to patients. This field is everly and rapidly evolving, with new advances in technology and knowledge improving evidence-based practice and patient outcomes. Although healthcare is accessible to many, some patient populations have limited access to providers and resources needed for the continuation of care. The healthcare role of a nurse practitioner can come with many barriers and challenges. Each setting, whether it be urban or rural, can have different challenges that the providers must overcome to improve the patient outcomes and quality of care. Some of these issues that a rural nurse practitioner can face are autonomy, practice regulations in regard to the state in which they are licensed, burnout, job satisfaction, and telemedicine protocols. Other issues include lack of resources and accessibility to healthcare. Rural patients tend to be more chronically ill patients due to the lack of resources and funds available to seek care. Not only is this an issue for the patient seeking care, but it can catalyze the job stress and strain on providers in rural areas. The increased patient load and acuity of the patients requires healthcare staff to spend more time and resources on those patient volumes than average in those areas where multiple healthcare facilities are easily accessible. The benefit to extending the scope of practice of a nurse practitioner is that the providers will be able to offer more care and intervention in these critical shortage areas, reducing the patient load and improving overall health in populations that reside in those areas. According to the study by Martin and Alexander, a group of people were polled, and they were coming to find out that people didn't mind to have a nurse practitioner, that the patient outcomes and public safety concerns were just about the same as they were with a physician or a medical director provider. The rural medicine providers study by Terry and Woe shows that the burnout are typically higher in the rural areas due to the lack of resources and healthcare shortages in those areas. And then the study by Brahm et al. Said that nurse practitioners were able to bridge that gap between patient and providers in those rural areas, allowing more providers to see those patient populations, improving the overall health of those communities. So how are we going to combat this issue? Nurse practitioners and providers need to propose change to state representatives. Initiating policy changes to improve policies and procedures related to nurse practitioners' scope of practice to better meet those needs of those patients in rural areas. By allowing patients and providers to participate in telemedicine, even when they don't reside in that area, would be able to extend the care to those patient populations in which there are critical shortages with providers, and improve healthcare all over those areas. And then we can also continue to do competency-based training like we would with our RN and BSN degrees. So just trainings throughout the year to meet competencies and then achieving milestones in training. And then we can improve policies and procedures to allow the scope of practice of practitioners in those rural areas to be extended, so there is no delay in care, and then that the process of the continuation of care isn't delayed either. So concluding this PowerPoint, there are obstacles that providers must face in every setting in healthcare, whether it be rural or urban. But two of the big issues are accessible and affordable healthcare, being able to reach those patient populations more easily and allow them other options when seeking care is going to be a game changer for those patient populations. Nurse practitioners can bridge the gap in rural settings where providers are lacking, allowing more patients access to healthcare while improving patient outcomes. So some of our follow-up questions to further the discussion are, as a family nurse practitioner, current student, and healthcare provider, do you feel it is important to be informed with current legislative laws regarding healthcare and providers in your area? And then do you keep up with that information if you do agree that it is an important aspect? So our second question is, what would you consider the pros and the cons of telemedicine and the increased scope of practice of nurse practitioners in your state if it is currently not already a full autonomy state? And then if you do practice in a full autonomy state,